Hi, I'm Nivi Singh. I work as a clinical consultant for an aged care provider in Sydney. I think my current profession found me. I'd like to think of it as a calling of sorts. I was confused as a science student at university when a friend of mine suggested nursing. I put in an application at the local nursing college and was accepted for an interview. At the interview, the matron seemed to like me, and then she offered me a placement as a nursing student. I started training in January 2017. After about 6 months, I found I really loved the job. The patients healed me as I healed them. I remember a pretty lady coming up to me in the street one day and thanking me for saving her life. I didn't recognize her at first. She had been in our health care unit and I had cared for her for a few weeks. She had sustained a gunshot wound to the face. The wound was very extensive at first, taking up most part of the right cheek. But after a lot of healing and coaxing, we managed to heal up that wound. It was really good to see her, and to see her happy and all healed with a very small scar. I could see how this job would be really good for me, because I wanted to help people. There are several things that excite me about my current profession. However, a few things stand out. Firstly, I enjoy helping people, as I explained previously. Second, I feel nursing has become such a dynamic profession. It's really amazing all the different types of jobs you can do as a nurse. You can be a clinician, or you can even specialize in things like midwifery or skin therapy. Nurse practitioners can assess, diagnose, and prescribe specific medications, improving Australia's healthcare system. All these great opportunities excite me about my current career. A few things I've learned about myself working in my profession is that I am a people person. I enjoy working with people, meeting new people, and helping them with their problems or healing their illnesses. I've also discovered I enjoy teaching and mentoring students and other healthcare professions if they require this. People say I'm good at it. I can't always see this in myself, but I feel very passionate about training nurses. I get really excited to teach them new concepts and see them develop. I seem to have the ability to empower people, and it always makes me so happy to see my nurses completing degrees, specializations, and becoming managers. My hope is the profession of nursing continues to develop with new technology and innovation. Maybe it's a science student in me, but I would like to see more advanced innovation, especially around bioengineering and nursing research. Looking into things like prosthesis of modular devices to facilitate walking and rehabilitation would be really good. We need to increase funding in these areas so that people with minimal income can benefit. My concern is that some people do not understand what it means to be a nurse. People become registered nurses for prestige or for pay, but they do not really want to care for people. They rush about, completing the tasks and ignoring the person trying to get their attention. Sometimes they can even be nasty or neglect the person. One day, I found a palliating resident in a soaking wet bed during a drug round. When I asked her why she didn't call a nurse to change her bed, she said the nurse did not really want to help her. She said every time she called the nurse came up to her and in a really harsh tone said, "What do you want now?" The other registered nurse and I assisted the lady, and she was soon clean, dry, and comfortable. We then had a chat with the nurse. Sadly, this sort of thing is occurring too often in hospital and in care homes. In an ideal world, I would like to change the negative views some other professionals have of nurses. Working in the hospital and aged care industry, I've seen doctors, architects, and even legal assistants treat nurses poorly, as they did not recognize them as professionals. A lot of people are ignorant of the nursing profession and think that nurses are simply bedpan washers. They feel anybody can do the job of a nurse, and it does not require specialized learning or development. Nurses are intelligent, resourceful, and kind professionals, and I would like everyone in the world to see them as this. Thank you for watching this video.